Auzu billahi minash shaitanir rajeem. Bismillahir Rahmanir Rahim. Thank you for joining us today on Minhajul Quran International Facebook page or the YouTube page. And we've got an amazing and an interesting and a much needed conversation and debate that's going to be taking place today. It is an online discussion on the COVID-19 vaccine. And as many of you guys, as all of us know, that heading into 2020, many of us had different plans. We had different aims and objectives and predictions of what 2020 was going to be. But what we didn't expect and what we, in many ways, underestimated in our own naiveness of living in the world was an expectation that would be part of a global pandemic where the norms of everyday life end and the new norms begin. In March, we had this discussion on this Facebook page and on YouTube about COVID-19. What is COVID-19? How it affects our lives, and we know now the ground reality of that. We, in the United Kingdom, we've had sadly almost 70,000 deaths, and globally touching 1.7 million people have sadly lost their lives due to this virus, and many people have lost their loved ones, mothers, fathers, daughters, children, and many friends have been lost during this pandemic. And we've changed our everyday life. Businesses are closed, restaurants are closed, our retail in many parts of the United Kingdom are closed, and we're living in new tiered system. Social distancing is something that we practice on an everyday occasion. But the question from March and early February was, once this pandemic hit, what was going to be the way out? And we all heard the conversation that we would be out of this once a vaccine came about. And now vaccines are here, but there's a great debate about whether you, or our loved one should take this vaccine. There's a lot of information out there, but a lot of misinformation as well. And that's why Minhajul Quran International UK has took it upon themselves to engage in this online discussion. So many people across the UK, many from within the Muslim community, can better understand this debate. And I'm grateful today to be joined by an illustrious panel of guests, both those who are experts on modern sciences as well as Islamic sciences, who can join me in this debate. So I'd like to welcome each one of them onto the panel now. First of all, if I can invite Dr. Wasim Khan, who's GP in principle in Glasgow, who's a cluster quality lead, who's also on various subcommittees in regards to drug and therapeutic medicine and many other things. He's also a representative of primary and secondary care interface group, and is an ex-Glasgow University tutor in general practice and primary care department. And also, I've got with me Dr. Muhammad Idris. Dr. Muhammad Idris is a specialist in general internal medicine. He specializes in diabetes, in chemical pathology. He's also a consultant physician in the Department of Geriatric Medicine at the Queen Elizabeth University Hospital. And I've also got with me Allama Shahid Babasab, who is the president of Minhaj Scholars Forum UK. So as you can see, we've got both the modern sciences as well as the Islamic sciences with us today, taking part in this debate. And our debate will be in the English language, but we're also going to be including Urdu as well, because a lot of the information is going out in various languages, and we want everybody to take part in this debate, whether you are young or you are old, whether you are somebody who's interested in science or somebody who's not interested in science. The reality is COVID-19 affects us all, and the way out will affect us all. And I'm going to just go to Dr. Wasim Khan first. Dr. Wasim, thank you for joining us today and being part of this panel. Let me just start off with my first question of today. And the question was, going into this pandemic, the reality really was that without a vaccine, there was no way out. Is this the ground reality for many of us today?
Assalamu alaikum and Bismillahir Rahmanir Rahim. First of all, we need to understand here. I think it's better for education purpose wise. Is it okay to, I can use some Urdu language as well? Okay.
Yeah,
Just
go
mix
ahead,
with together. Okay. First of all, we need to understand what is this COVID-19. Okay. We all say if you simply says COVID. So coronavirus disease. Okay, and coronavirus was already there. Okay, but this is a new thing which developed. So whenever it's developed, we need some protection. Allah Ta'ala gave us natural immunity system, but there is a way, just like Prophet Muhammad Sallallahu Alaihi Wasallam advised, whenever there is a disease, we need to make sure get treatment. So cure wise as well. So there are science has done so much like कामयाबियां मुख्तलिफ स्टेज के ऊपर कि दे डेवलप सम सर्टेन प्रोग्राम जिसको कहते हैं जस्ट लाइक ए वैक्सीन प्रोडक्शन. अगर बाज डिजीज ऐसी हैं जिसके लिए जरूरी है कि इसको डिजीज को कंट्रोल किया जाए, वो ड्रग से ट्रीटमेंट होता है. अगर ड्रग से ट्रीटमेंट के बजाय उसको प्रिवेंट करना है तो वैक्सीन डेवलप होती है. जैसे हम पहले ऑफ द रिकॉर्ड डिस्कस कर रहे थे, मेरे ख्याल में वैक्सीन जो है जस्ट लाइक एक टीचर है. जब वो इंट्रोड्यूस होता है हमारी बॉडी में तो एक हमारे नेचुरल जो क़ुव्वत मुदाफ़ियत पैदा करने की सलाहियत होती है इम्यूनिटी सिस्टम को, उसको मैसेज देता है. उसकी वजह से हमारी बॉडीज में क़ुव्वत मुदाफ़ियत पैदा होती है जिसको हम कहते हैं एंटीबॉडीज पैदा हो रही होती हैं. तो उस एंटीबॉडीज की वजह से, स्पेसिफिक एंटीबॉडीज की वजह से इस डिजीज को कंट्रोल किया जा सकता. अब क्यों जरूरी है इसका अंदाजा इस लिहाज से है कि हमने देखा कि WHO ने मार्च 2020 में इसको पैंडेमिक करार दिया कि इट वाज अनकंट्रोल्ड, इट वाज स्प्रेडिंग सो सिग्निफिकेंटली एंड अफेक्टिंग ऑल ओवर द वर्ल्ड. इसका असर ये हुआ कि ऑब्वियसली बिकॉज मेंटली, फिजिकली, सोशियो इकोनॉमिकली देयर आर लॉट्स ऑफ सफरिंग, तो उसको रोकने के लिए जरूरी था. सो दिस इज वन ऑफ द रीजन वैक्सीन इंपॉर्टेंट है. वैक्सीन इंपॉर्टेंट है to establish the immunity in our system, to protect ourselves, our loved one. इसके अलावा हमारे नेबर, कम्युनिटी मेंबर्स, उन सब के लिए जरूरी है. I think this is most important. We need to just understand how significantly important any vaccine is, and because this is a new disease, we are dealing with a new disease, so that's one of the reason it's very important. And there are lots of questions regarding the vaccination program as well, and inshallah ta'ala in between we'll be discussing during our forum discussion.
Jazakallah. Yeah, we're going to come up with many questions. I'm sure many people watching live have questions, and this is what the reason we're having this is because the reality is this conversation is happening. It's happening on WhatsApp groups, it's happening on Facebook, it's happening on social media, and where these conversations were happening decades ago, they are happening much louder on social media. So you are live on Facebook. Any questions you want to ask the panel, please feel free to drop a comment in the comment box, and I'll try to get through as many as possible. But coming to Dr. Muhammad Idris, we've talked about the need for a vaccine, but there are multiple vaccines at the moment. The Pfizer vaccine, the Moderna vaccine, the Oxford trials are happening at the moment, and there's differences of these vaccines. What are the differences, and which one should we take, or which one? Because the Pfizer one's going out now, which has been regulated. Tell us a bit more about these vaccines that are currently there.
Bismillahirrahmanirrahim. First of all, I would like to thank Minhaj al-Quran International took the initiative. This is very good from our religious organization and educational organization, I would say, to take such an initiative when there is a lot of misconceptions are being spread by the social media mostly. The mainstream media has a responsibility, so they will never ever act that way. लेकिन जो सोशल मीडिया है, चूंकि उसका कोई कंट्रोल नहीं है, उसका कोई रूल रेगुलेशंस नहीं है मोस्टली, और अंडर द फ्रीडम ऑफ स्पीच यू कैन से एनीथिंग और व्हाटएवर यू वांट टू से, तो चूंकि इसकी रिस्पॉन्सिबिलिटी नहीं होती, इसलिए अभी जो इंटरनेशनली बिग नंबर ऑफ रूमर्स जो हैं वो फैलाए जा रहे हैं वैक्सीनेशन के बारे में, वो बातें हम लेटर ऑन डिस्कस करेंगे इंशाल्लाह. तो ये जो आपने 4 का नाम लिया, मेरा 3 का नाम लिया है वैक्सीनेशन जो कंपनीज बना रही हैं, लेकिन ये तकरीबन 100 से ज़्यादा कंपनीज ने काम स्टार्ट किया था. उनके ट्रायल्स वेरियस लेवल पे हैं, लेकिन चूंकि हमारी गवर्नमेंट जो यूके की है उसकी इंटरेस्ट 4 कंपनीज में है. उनमें से 3 का आपने नाम ले लिया, एस्ट्राजेनेका, ऑक्सफोर्ड और मॉडर्ना है, और उसके साथ फाइजर जो सबसे पहले आगे आ गई है, फाइजर, और उसके साथ जर्मन कंपनी, दोनों ने मिलकर बनाई है, और चौथी जॉनसन एंड जॉनसन है। तो यूके गवर्नमेंट ने इन तीनों से बाई कर ली हुई है, पहले प्री ऑर्डर बुक किए हुए हैं मिलियंस ऑफ, मसलन अगर फाइजर की बात करें तो तकरीबन 60 मिलियन जो हमने पहले से ही वो इंजेक्शन जो है उनकी ऑर्डर दे दिया हुआ है। उसके बाद हमारे पास मॉडर्ना, क्योंकि वो सबसे एक्सपेंसिव है इसलिए उसका ऑर्डर 30 मिलियन के करीब है। एस्ट्राजेनेका ऑक्सफोर्ड क्योंकि हमारा अपने यूके कंट्रीब्यूशन के साथ बन रही है, तो उसमें हमारा 100 मिलियन का तकरीब ऑर्डर है। ऐसा ही हमारा जॉनसन जॉनसन के साथ भी 30 मिलियन के करीब ऑर्डर हैं। अब इतनी ज्यादा वैक्सीनेशन गवर्नमेंट ने क्यों बाई की है? अब इनमें जाहिर है, एक तो फर्स्ट ऑफ ऑल, जैसे आपने अपने इंट्रो में बताया कि the people were affected, not only physically people were dying, they were affected emotionally, socially, financially, और उनका जो साइकेट्रिक डिजीजेस थी बहुत ज्यादा बढ़ रही थी इसके साथ साथ। अब जिस भी कंट्री को आप देख रहे हैं उनकी इकोनॉमी जो है इस वक्त बैडली अफेक्टेड है। यूके गवर्नमेंट ने इस पे इतना ज्यादा इन्वेस्टमेंट इसलिए किया कि जितनी जल्दी इस पैंडेमिक पे या विद इन द कंट्री हम कंट्रोल कर लेंगे, हमारी इकोनॉमी इतनी जल्दी ग्रो अप करना शुरू हो जाएगी। अब ये एक तो मेन वजह यही थी कि जो भी पहले बनाएगा यूके गवर्नमेंट उसको असेस करेगी, हमारा जो रेगुलेटरी बॉडी है ड्रग की वो उसको असेस करेगी, और जिसकी भी वैक्सीनेशन पहले आ गई उसको हम शुरू कर देंगे। तो जैसे आपको पता है कि रिसेंटली जब हमने वैक्सीनेशन नेशनल हेल्थ सर्विस ने शुरू की है, तो उन्होंने एक टारगेट पॉपुलेशन को किया है। डॉक्टर्स एंड मेडिकल स्टाफ जो है, पैरामेडिक्स, वो उनको फ्रंट लाइन जो वर्कर्स थे उनको प्रायोरिटाइज किया। साथ में वो पॉपुलेशन जो कोविड-19 के 1 साल के दौरान बैडली अफेक्ट हुई थी, मैक्सिमम डेथ जो हुई थी वो हमारा 80 इयर्स को अबव जो एज ग्रुप है उसमें हुई थी। तो उन्होंने कहा कि इन 2 ग्रुप्स को पहले सेव किया जाए, उसके बाद बकिया पॉपुलेशन को फेज वाइज जो है वो वैक्सीनेशन की जाए। अब स्ट्रक्चरली इनमें क्या डिफरेंस है? जैसे वसीम भाई ने बताया है कि मैसेंजर आरएनए वैक्सीनेशन, दैट इज फाइजर एंड बायोटेक जो कंपनी है इनकी बनाई हुई मैसेंजर आरएनए, ये एक ही, मॉडर्ना, दोनों की एक ही टेक्नोलॉजी है। ये टेक्नोलॉजी थोड़ी सी मॉडिफिकेशन के बाद उन्होंने यूज करना शुरू की, तकरीबन आप कह सकते हैं 10 महीने पहले, लेकिन ये टेक्नोलॉजी वाज अराउंड मोर देन 30 years. They have tried it for various type of vaccinations, but that was not that successful. और दूसरे जो बीमारियां थी जो कि इतनी ज्यादा डेंजरस भी नहीं थी, इतना पैंडेमिक भी नहीं हुआ था, इसलिए उन पर ज्यादा टाइम लगाने से पहले जो दूसरी टेक्निक थी उससे वैक्सीनेशन आ गई, तो ये टेक्नोलॉजी यूज नहीं की गई। However, क्योंकि ये टेक्नोलॉजी ऑलरेडी अवेलेबल थी, तो ये 2 कंपनियां जो थी जर्मन और यूएसए बेस हैं, इन्होंने ये डिसाइड किया कि क्यों नहीं हम उस टेक्नोलॉजी को जो कि अवेलेबल है और उसमें कोई जो एनिमल इंग्रेडिएंट है वो इस्तेमाल नहीं होगा, तो उन्होंने इंजीनियर्ड सीक्वेंसिंग जो थी आरएनए की वो बनाई, और उसको एक मैसेज, जैसे हम मैसेंजर आरएनए कहते हैं, मींस मैसेंजर का सबको पता है कि खात ले जाने वाला, जब मैसेज ले जाने वाला जो भी है मैसेंजर आरएनए, वो राइबोन्यूक्लिक एसिड वो मैसेज लेके जाएगा, जब हम बॉडी में इंजेक्ट करेंगे तो वो बॉडी के सेल को ये बताएगा, वो उसमें एक चेंज लाएगा। राइबोन्यूक्लिक एसिड जो है हमारा सेल का, उसके अंदर एक चेंज लाएगा जो एक एंटीजन प्रोड्यूस करेगा। एंटीजन का मतलब ये पार्ट ऑफ द वायरस जो स्पाइक है उसकी तरह वो प्रोड्यूस करेगा, और फिर वो हमारा जो डिफेंस सिस्टम है, हमारी जो अपनी बॉडी की आर्मी है, उसको एक्टिवेट करेगा, कहेगा कि भाई इस तरह का जानवर जो एनिमल है या जो अटैकिंग वायरस है वो आ रहा है आपकी तरफ, इसके लिए आप तैयार हो जाएं। तो आपकी जो आर्मी है वो तैयार हो जाती है। पहले इंजेक्शन के बाद फिर आपको 21 दिन के बाद दोबारा इंजेक्शन लगवाना पड़ता है। तो ये तो है एक टाइप की वैक्सीनेशन जो मैंने बताई है। दूसरी जो है वो एस्ट्राजेनेका एंड ऑक्सफोर्ड हमारा जो बना रही है इस वक्त, वो भी फेज 3 ट्रायल्स में है, लेकिन अभी तक वो चूंकि उनका डाटा प्रेजेंट नहीं हुआ और हमारे पास जो हमारी रेगुलेटरी बॉडी है यूके की, उन्होंने इसको नहीं किया सर्टिफाई, इसलिए वो हम यूज नहीं कर रहे। उसमें क्या किया उन्होंने कि जो वायरस का स्पाइक है, अगर आप वायरस को देखें बहुत सारे पिक्चर्स अवेलेबल हैं, तो उसके पे स्पाइक्स हैं, वो स्पाइक उन्होंने उसी को यूज किया हुआ, उसको ब्रेक करके उसको यूज किया, लेकिन उसकी प्रोडक्शन में टाइम लगता है, तो इसलिए एस्ट्राजेनेका को टाइम लग गया है उसको मार्केट में लाने में। और स्टेबिलिटी इसकी बड़ी इंपॉर्टेंट है। वसीम भाई ने शुरू में बताया कि ये जब चेन है एक, वो मसलन -70 पे जो हमारी फाइजर की वैक्सीनेशन है -70 के नीचे चला जाए तो उसकी स्टेबिलिटी जो है ट्रांसपोर्टेशन के दौरान नहीं रहती और उसकी यूटिलाइजेशन नहीं रहती। हाउएवर लेकिन जो एस्ट्राजेनेका की होगी वैक्सीनेशन, उसमें टेम्परेचर जो है वो 2 to 8 डिग्री सेंटीग्रेड पे आराम से जो फ्रिज का टेम्परेचर है उसमें आप रख सकते हैं, और दूसरी दोनों का भी इसी तरह का ही मैकेनिज्म चलता है।
Jazakallah. I think Dr. Muhammad Idris went into quite a bit of detail there on the vaccinations and also the differences in them. I think we're going to come into these questions, the questions of, I'll probably come to Dr. Wasim very shortly before I come to Allama Shahid Babar Saab on whether these change, you alter your DNA and these sorts of things. But first, Dr. We got Allama Shahid Babar Saab with us, who's the representative from the Minhaj Scholars Forum in the United Kingdom, who's a president. Look, we've had great conversation about how the UK has ordered 30 million vaccines and they've ordered this vaccine and that vaccine. Allama Saab, vaccine तो है लेकिन तावीज़ सस्ता नहीं होगा, तावीज़ से काम नहीं होगा।
तावीज़ से काम होना होता तो तावीज़ों वाले कोरोना को दाखिल ही ना होने देते यूके में, और यहाँ पर तो बहुत बड़े तावीज़ वाले हैं। तो हर चीज़ का अपनी अहमियत और इफादियत होती है, और तावीज़ अगर हम इसको तवक्कुल का नाम दे लें तो ज़्यादा बेहतर रहेगा। तवक्कुल, ट्रस्ट इन अल्लाह सुब्हानहू व तआला। इंशाल्लाह लेटर वी विल डिस्कस। तो बात यह है कि देखिए, सब शरीयत में, इस दीन इस्लाम में अल्लाह ताला ने इंसानी जान का जो तहफ़्फ़ुज़ है उसको सबसे ज्यादा प्रायोरिटी दी है और नंबर 1 पे रखा है। शरई मकासद को देखें ना तो 5 हैं, उनमें से नंबर 1 जो है वो इंसानी जान की सिक्योरिटी है, उसको तहफ़्फ़ुज़ देना है, उसको बचाना है। और इस वक्त जिस पेंडेमिक में हम रह रहे हैं और जिस परेशानी में हमारी सोसाइटी और हमारी कम्युनिटी उसको फेस कर रही है, देखिए आपने शुरू में बताया कि इस वक्त 70 million people they are affected by coronavirus और 1.7 they are died। वो इसकी वजह से देखिए कि मर चुके हैं, और उसकी मेन रीजन क्या है? देयर वाज नो रेमेडी एट ऑल। सारा ये और ये जितने भी हमने प्रिकॉशन एसओपीज थे, दैट वाज द टेम्परेरी, वो उसके प्रिकॉशनरी मेजर्स थे जो मसाजिद में हमारी कम्युनिटी ने और एवरीवेयर वी ऑब्जर्व देम, मगर इसका परमानेंट अभी सोल्यूशन नहीं है। अभी जो सोल्यूशन आया है वो वैक्सीन की सूरत में है, एंड दैट इज आवर मॉरल रिलीजियस ड्यूटी टू वेलकम दैट सोल्यूशन, दैट रेमेडी, वो वैक्सीन है। अब कुछ जो इसमें अच्छी चीज है सबसे ज्यादा वो ये है, जैसे डॉक्टर इदरीस साहब ने बताया कि इसमें जो इस वक्त फाइजर की वैक्सीन इंट्रोड्यूस हुई है और जो सबसे ज्यादा इस वक्त सबसे पहले मार्केट में अवेलेबल है, देयर इज नो अनलॉफुल इंग्रेडिएंट इन दैट। उसमें कोई एनिमल का कंपोनेंट नहीं है, वो बिल्कुल जैसे हलाल मेडिसिन आप ले रहे हैं तो ऐसे हलाल वैक्सीन है। तो उसमें एक तो ये वरी करने की जरूरत नहीं। दूसरी जो चीज जिस तरफ मैं इशारा करना चाहता हूं, देखिए ये इस हद तक फैल चुकी है कि इस वक्त कम्युनिटीज इसमें और कंट्रीज, पूरे के पूरे कंट्रीज, दे आर सफरिंग विद दिस। और इसको हम कैसे रोक सकते हैं? इसके लिए हमें हर्ड इम्यूनिटी सिस्टम डेवलप करने की जरूरत है, इंडिविजुअली नहीं, एक कलेक्टिव इज्तिमाई जो कुव्वत मुदाफअत वो पैदा करने की जरूरत है। वो कैसे हो सकती है? और वो ऐसे है कि आप देखिए कि अगर 70% ऑफ द कम्युनिटी वो if they are 100% healthy with immune system, तो फिर वो फेस करने की पोजीशन में हो सकते हैं। और ये सूरत हाल नहीं है। आप देखिए कि हर्ड इम्यूनिटी सिस्टम दो तरीकों से डेवलप हो सकता है। एक तो यह है कि हम उसको लेट इट स्प्रेड, इसको फैलने दें, और जो मजबूत इम्यूनिटी सिस्टम वाले होंगे, इफ दे हैव द वेरी स्ट्रॉन्ग इम्यून सिस्टम, दे विल सर्वाइव, और जो कमजोर होंगे वो बेचारे मर जाएंगे। और ये गैर शरई तरीका है, ये शरीयत इस चीज की इजाजत नहीं देती। और इसमें आप देखिए कि कितनी जानों का ज़िया होगा, जो कि इस्लामिक जो कम्युनिटी है और एज ए ह्यूमन बीइंग, ह्यूमन सोसाइटी में इंसान की जान को बचाना, वो कोई भी जान हो, वो मुसलमान हो, वो नॉन मुस्लिम हो, उसकी जान इक्वली उसको बचाना ज्यादा जरूरी है। और दूसरा तरीका आप देखिए कि ये है कि वैक्सीनेशन की तरफ जाया जाए। ये शरई तरीका भी है और लॉजिकल भी है। और इसमें आप देखिए कि शरीयत ने हमें एनकरेज किया है कि जब भी किसी किस्म की इस तरह की बीमारी आए, हम उसके लिए उसका इलाज दरियाफ्त करें, उसकी दवाई लें, उसके लिए असबाब जितने भी अवेलेबल हैं उनको बरोए कार लाते हुए अपनी जान और दूसरों की जान को बचाने की फिक्र करें। अब यहाँ पर सवाल ये पैदा होता है कि जहां पर जितने ये लाखों लोग जो मर रहे हैं, और ये कोरोना वायरस जो कि एक कंटेजियस डिजीज है, जो एक बंदे से दूसरे की तरफ जल्दी वेरी स्पीडी ये ट्रेवल कर रही है। अब इसमें अगर हम ये सिर्फ ये कहें कि वैक्सीनेशन इज परमिसिबल, दैट शुडंट बी एनफ। स्कॉलर्स को चाहिए कि इसकी परमिसिबिलिटी से आगे बढ़कर कम्युनिटी को समझाया जाए कि चूंकि ये कंटेजियस है, ये किसी एक जात को नुकसान नहीं पहुंचा रही, किसी इंडिविजुअल को नुकसान नहीं पहुंचा रही, बल्कि एक इंडिविजुअल अगर इलाज नहीं करता और वैक्सीनेशन नहीं लगवाता और अपनी बीमारी को खत्म नहीं करता, उसकी वजह से सैकड़ों और लोग मुतासर हो सकते हैं, वो और लोगों की मौत का सबब बन सकते हैं। तो ऐसी सूरत में फुकहाए कराम ने, शरीयत ने इस पर तफसील से लिखा है कि वो चीज जो वैक्सीनेशन, ऐसी बीमारी का जो इलाज है, वो जस्ट परमिसिबिलिटी के लेवल पर नहीं रहता, बल्कि ऑब्लिगेटरी हो जाता है, फर्ज के दर्जे में आ जाता है कि वो शख्स जो दवाई नहीं ले रहे वो दूसरों की अमवात का सबब बन रहे हैं। तो हर बंदे के लिए, हर मुसलमान के लिए जो शरीयत पर और हुजूर नबी पाक सल्लल्लाहु अलैहि वसल्लम की सुन्नत पर ये एतकाद रखता है, उसके लिए जरूरी है कि इस इलाज को बरूए कार लाए और अपनी भी जान का तहफ्फुज रखे करे और दूसरों को भी जान को खतरा न बने।
Thank you, Allama Sahab. Can you just say a few of those important points in English? We're having a bilingual conversation. It's always difficult to have that kind of conversation, but just the major points you mentioned, if you can have them in English, about herd immunity being on survival of the fittest, being against Sharia.
Yes, you can't face the collective problem with individual immunity. We need herd immunity system, and that can be developed only through the vaccine. Through vaccine. Another way, that is an unlawful. Let us spread and then see who is going to die and who is going to survive. That is an unlawful mean. That is not permissible in deen. The other way, which is recommended by Holy Prophet sallallahu alaihi wasallam, which by Quran, where Allah subhanahu wa ta'ala, every single disease has remedy. We need to derive from our different sources what is the remedy, and that is also, alhamdulillah, we have in the market. That is started, then the result is a very, very good percentage, 90%. That is really courageful, and that is the important point. If we just say this is permissible, that shouldn't be enough. This is obligatory in this situation we are living. We are facing COVID-19. That is contagious disease, and one individual who is the carrier of COVID-19, he can affect a lot of people in the society. So that is obligatory for him to have a vaccine, and which is halal. Even those that is, if that is haram, that is even permissible for the people. Sharia gives this gunjaish and this room for Muslim people and non-Muslim as well to have a haram in the when you need to survive, when you need to save the life. But this is, alhamdulillah, this is halal already. So we need to, we don't need to get scared from this.
I think there's various important points Alama Saab's mentioned there. It's halal. Look, survival of the fittest is not an Islamic concept. We believe in helping those who are weak and vulnerable. And it's not just a permissible act, it's a moral duty for us to take the vaccine in these conditions. But Dr. Wasim Khan, and I want to say to those who are listening out there, today we are having a very frank discussion. On many shows, we talk about the politics, the economics, the philosophical and the psychological, or even these sorts of arguments of the debate. But the reality is, because this conversation has spread like wildfire on social media, that is why I'm having such a frank discussion. And of course, Alama Sahib mentioned that Taweez and Wazaif have their own rank within Islam and have their own position within Islam, but so does these aspects. And I will continue asking these sorts of frank questions with the panel. And here comes another frank question to Dr. Wasim Khan, because this is a reality going out there, Dr. Wasim Khan. Can you tell us whether this vaccine is going to have some kind of microchip that Bill Gates is sponsoring and putting into people, and how they're going to control people? How does that going to work? Because a lot of people are being passed this misinformation that there's a chip in this and they can control. And I'm having a very frank discussion, because I've even heard to such levels on WhatsApp, and हमको पता है जो हमारे ग्रुपों में जाता है, what kind of videos are shared, and some are completely ridiculous and bogus. But we need to have that conversation open and frank. Dr. Wasim Khan, this microchip, what do you have to say about this?
Okay, Jazakallah. It was a very valid question you asked, brother, because as we know, Dr. Idris already explained about Pfizer vaccine. As we know, we always say it's Pfizer, BioNTech. These are the two companies who collected all the data and processed everything, gone through every single trial, like trial 3. And then when the MHRA, which is a medicine and healthcare agency, independent, they accepted the data and they find out, okay, this is the very efficacious vaccine. So that's one of the reasons Pfizer and COVID vaccine was introduced in our NHS system to be given to the vulnerable people first. Dr. Idris already mentioned what's group initially and why it is mentioned. To maintain the efficacy of this COVID-19 vaccine, which was developed by Pfizer and BioNTech, they need a -70 for storage purpose-wise. So obviously that's a real challenge for its cold chain supply and every single thing from factory to distribution, every area. So it may need to maintain the temperature. I mean, I don't know how it came to the social media that is this vaccine contained microchip. Basically, there is a box which is just like a pizza box. So once from the factory, once it's distributed, it goes outside to maintain, to check properly, accountability, to make sure that this vaccine is efficacious, that is not invalid due to uska temperature kam ho jaye ya kuch ho jaye. That box is monitored. So that got a chip, which means so agencies could look into it that yes, this box has been delivered to hospital A and their temperature was properly maintained. So it means anyone like you, me, or anyone, depend upon the population cohort group, whoever getting the vaccine, they know they are getting a true vaccine, the vaccine which is valid. So this is one of the reasons. But if you see the ingredient in it, it's only a small like nanoparticle of lipid that's basically present with this vaccine, mRNA vaccine. And just like Allama Shahid Saab says as well, regarding there is no ingredient about which can describe this is non-halal. But important thing is this: to maintain and to check, balance the temperature efficacy of this vaccine. It's a not vaccine, but for the box wise, that's one of the reason it chipped on the box, but not in the vaccine at all.
I think that's a very important point, because that doesn't just open the debate about the actual transportation of the virus, so transportation of the vaccine, but also how this is going to, how certain vaccines are going to be much more important in different countries. Many countries around the world, including the global south, don't have refrigerators, don't have the technology and the equipment to utilize this kind of stuff, and therefore I'm sure we're going to hear how the Oxford vaccine might be better in those countries because it needs a lower refrigeration. But just coming to Dr. Mohammed Idris on this issue, there's a major question which many people ask, and that question is, if I'm right in saying that major vaccines usually on average take 10 to 12 years to develop, or even longer, but this vaccine has been developed in a matter of months. How can people trust a vaccine that's just happened in a matter of months? And if I'm right in saying it passed the emergency trials for a vaccine, if I'm right in saying that.
Yeah. Yes, I think this is an important question, or I think the people has a right to ask this question, because there are obviously some traditional ways of making vaccine, and took years and years initially. We do understand as a medical community, and we know that this is the vaccine which is ready to use in human beings within 12 months. Yeah, that's why the people are raising this question. There are various factors. Number one, as I already mentioned, the technology was already there. Number two, because in the past, when any new trials, new vaccinations were required, we were writing letters to the people to participate into that situation. And the sufferers were like few people. We were not like a pandemic. In this situation, national level of campaigns were run in a worldwide various countries, where the people volunteered in thousands without thinking that what's going to happen. In the UK, thousands of emails came across to our email boxes, being health professionals, that whosoever want to participate, come forward, come forward. Phase 1, phase 2, phase 3 trials. Likewise, in rest of the world, same companies were running the parallel investigation and giving the initial smaller dose, then a bigger dose, then increasing the number, using the placebo as well at the same time. And I mean, a good thing about this social media used as well. I mean, I won't say social media is bad all the time, but that was used to raise awareness about the need of the vaccination. And the mainstream media was used to raise the awareness to how this was volunteer, to find out the volunteer to come forward. And as we all know that 43,000 participants as a volunteer participated into the Pfizer vaccination. So 43,000 number, to collect that many people data in the past wasn't possible. But now it is because of electronic media and all media available. This was so quick to find and return the data from the central lab, as well as checking antibodies level, PCR doing. All these technologies are much, much faster than they were before. And other thing is, we need to remember, we are in a pandemic. We are not in a situation where a couple of million people are affected, or one part or one community is affected. This is the situation where whole humanity is affected. And I don't think there is any island on the world where there is no patient with this disease. Keeping in mind all this, data was collected quicker day and night. Technology was there, and the response was also looked at placebo as well as the drug trial. People, their data was compared, and that all clear data was presented to the authorities, for licensing. So if we look at all the factors, that where the facilitation came, government facilitated it. Free government funded for these vaccinations. I know Pfizer did not get any funding. However, many other companies did get a funding to get a vaccination as soon as possible, because we wanted everyone to survive, everyone be able to fight against this pandemic so that we can go back to normal. Once all these factors come together, and then there was willingness by the authorities as well as by the people who wanted to participate in the trials, and then data analysis was quick, as well as technology was faster than before. All these factors helped to bring this vaccination into action within 12 months. I hope I answered the question.
Yeah, you did. There's many more questions coming. I think in the last few minutes, we've had questions literally being driven down. So let's quickly get through some of the more technical questions, and we'll continue this debate as well. So Dr. Wasim Khan, there is some hesitancy about vaccines, and that's just not this vaccine, that's vaccines in general. So if you can answer that question, but I'm going to give you a couple of other questions alongside this because there's so many questions coming. So the first question is on vaccine hesitancy. Should people be hesitant about vaccines? Dr. Mohammed Idris did explain we're living in different territory. We've never had the sort of funding, the support, the need as we have today because of global economies and everything else. Then there's the actual trials and the tests. Many people are worried about the reports from CDC and the health impacts on certain people and side effects that come from vaccines. And lastly, within that question as well, can this vaccine alter your DNA? The Pfizer one itself, can it alter your DNA? And can we have vaccines without any risk? And that's the questions for you, Dr. Wasim. I know I've put quite a few to you at this one time, but there's literally lots of questions, and we're going to try to go through every question, as many as possible that people are asking. So please do continue to ask your questions online. Dr. Wasim.
Yeah, thank you very much. Yes, we are having these journal discussion, even my family member asking about those as well. So there's lots of question there. First of all, we need to understand these things. Vaccine process is vaccination program is not recently developed. It's been developed for years and years. And we know all the data available as well. We know all these diseases, polio, tetanus, diphtheria, pertussis, there are lots of things. We take vaccine as a childhood immunization program. Certain vaccine we take as a part of the travel vaccination. There are vaccination there. And approximately 3 million deaths actually worldwide every year saved due to these vaccination program. And I must tell you one thing, the people asking this question and WHO recognize these things, not because of this only for COVID vaccine, but for all vaccine hesitancy. World Health Organization recently listed vaccine hesitancy as one of their top 10 biggest threat to global health. This is very significant sentence. They're not talking about for any vaccine, they are talking generally. So vaccine hesitancy is top 10 biggest threat to global health. And we have seen so many cases differently as well. But yes, it is important, vaccine hesitancy there. And I think there are so many questions. It is important that we talking about vaccination program. I think I saw this one vaccine program as well. Sorry, one question about the vaccine. This mRNA change the DNA. Is that right, Moving right? What are the other questions? Sorry.
Yeah, that's one of the questions. Will the mRNA vaccine alter the DNA? And there's many arguments about how this affects fertility and these sorts of things and pregnancy issues. So will it alter the DNA? And for example, will it impact pregnancy? Many people in Pakistan, so if you want to change this question to bilingual question in English and Urdu, many people in Pakistan are having this question that, before pregnancy, you shouldn't be taking this vaccine. These sorts of questions are arising. Just so you can shed some light on this, actually.
Okay, we already discussed these things. Idris Bhai already explained regarding the specific messenger NRAs and related to the protein as well. So antibodies production due to this vaccine is specific for that COVID-19. Okay, that's specific for that virus. There's no data or no report or anything that's affect the DNA. So that's totally wrong belief. Okay, one thing. Second thing is why they talking about whether it's regarding the uh, taking in pregnancy or will it affect the fetus. I can see one question in front of me as well on the screen. Basically, it's difficult to say at the moment because in approximately 44,000 normal population, those who participated in trial, their age group actually like include from 16 to 85 years of age, and any female there, they were not pregnant. Okay, under 16 they were not present, above 85 they were not present. So if somebody says and bluntly saying, oh, it can't affect, it's wrong. Because the data was not available, this is for the safety factor. That's why it's advisable not to take in the pregnancy. Because this is because our practice, our medicine practice is all evidence based. We normally go depend upon the evidence. We just don't go blindly, okay, let's try this thing. We always make sure that research is available, data is available. And this is one of the reason, because of that age group from age 16 to 85, is safety, all the efficacy, all the clinical trial checked only on that age group. That's why it's suggesting not to take those who are pregnant. Second thing is also this, because there is no data about it. So this is one of the reason you can't argue, you can't say about effect on the fetus as well. Okay, not only pregnant, non-pregnant female was included, but also there are certain other people not included in that trial as well. And the reason why I agree these things, anyone suffering from any immunocompromised disease, chronic diseases, they try to avoid these things in the trial as well. So they included all healthy individual, and most important thing, also they checked they should not be COVID-19 positive in that trial. So their test was done to make sure they were not COVID-19 disease positive. Okay, and that's one of the reason, one of the criteria to be including in that trial as well.
Thank you.
Okay, so I think there are so many concepts. I think when these questions keep coming, answer we will be able to give all the explanation as well. There was a one question, somebody asking about HIV is there, why there is no vaccine. So I must say here, as I said, vaccine program parallelly going on everywhere. All these big companies, they are making not only HIV. If I'll give you one of the specific, like very common disease called Streptococcus B. So their vaccine has not been produced yet. And Oxford University team, they have been trying for years. It's not only HIV. There are so many other diseases there as well where the work is going on. Yes, sometimes we get a successful result. That's why these trials matter. Evidence is there. People getting positive effect, like efficacy was there, and this is one of the reason is this COVID-19 is selected. Is not a new thing because the work is already going on. Different technologies, how to produce vaccines, that's already going on. So this is one of the reason it was quite easily produced and available in short term.
Yeah, and many of the doctors have already said that these are many of these are logical questions. Please ask these questions, because the reality is once you ask, you'll understand. You'll understand the fact that in 8 months, if you're going to develop a vaccine, obviously you're not going to have the complete data that you would if you did in 10 years or 12 years time, even though you probably had the funding and the support that does probably mitigate those factors. But coming to Alama Saab now, Alama Saab, look, when it comes, and I'm talking about the ordinary layperson, the individual who isn't a doctor, who doesn't understand the difference between a protein vaccine, the mRNA vaccines, or the different types of vaccines that are out there, that don't understand the the details and the intricacies of this kind of work. Because the reality is, and we know this, that you have to be a specialist. I think one of the problems I think people realize in Islamic sciences that just because if somebody is a scholar of hadith, they might not be a scholar in fiqh. They might not have the expertise in different sciences. And likewise, that's why we've got experts in the areas today. But for the average layman, isn't this the same? And you can correct me if I'm wrong. Isn't the reason we have the Hanafi fiqh, the Maliki fiqh, the Shafi fiqh, that an ordinary person doesn't have to go through the intricacies of each detail? They can follow the guidance of the experts there. Shouldn't the average Muslim, rather than spreading this idea on WhatsApp without knowledge of vaccines, without knowledge of data and these sorts of things, and they're not experts, rather be looking for the experts? And what role should Islamic sciences, Islamic scholars play in this, and how should an ordinary person react in this situation? Allama Sahab.
जी, बहुत अहम सवाल है। देखिए कि हमारा सबसे बड़ा जो मसला है कम्युनिटी का, वो इग्नोरेंस है और लैक ऑफ नॉलेज है, लैक ऑफ इंफॉर्मेशन है, जिसकी वजह से ये सारी कॉन्स्पिरेसीज डेवलप होती हैं. एंड अनफॉर्चुनेटली, and that layman you are talking about them, all of them depend on the information given by social media. Their reliance is only in social media. They never go to the experts. They never listen them. They are not ready to get the opinion from the experts. और ये देखिए कि जो जितनी भी rumors हैं, जितनी conspiracies हैं, that is the part of the game. ये हिस्सा है. If you go in history, any vaccine, this is an extraordinary remedy when it was introduced in the society. So there are certain people anti-vaccines like this we are facing now. Always they do this type of activities. You can't control them. Only the way is giving them information in proper manner. Information can beat the disinformation. अभी आप देखिए कि हमारे कितने स्कॉलर्स हैं, हमारे कितने इंस्टीट्यूशंस हैं जो इस तरह की एक्टिविटीज कर रहे हैं, जो इस तरह के प्रोग्राम्स कर रहे हैं, मसाजिद में अपनी कम्युनिटी को इस तरह एजुकेट कर रहे हैं. That is our primary responsibility. As Minhajul Quran, alhamdulillah, is performing. When COVID-19 in March, it was, there was a pandemic. Shaykhul Islam, Dr. Muhammad Tahir al-Qadri took a step. He took initiative. And he introduced everything related COVID-19 and precautionary measures. Religious aspect of this, our responsibility, and moral aspect of our, responsibilities. उन्होंने सारी ये चीजें दी, and there was a series of lectures. Alhamdulillah, Minhajul Quran is doing now this program to bring our community in this circle of information. ये हमारी सबसे बड़ी जिम्मेदारी है. और दूसरी चीज आप देखिए, for our just public, general public, they believe on their butcher where they bought, they buy the everyday, the meat, the chicken. Do they believe? Is it halal or haram? Definitely they believe. They go to butcher and they just ask, this is halal. But they never ask their certificate. Is it done by, in proper manner or not? क्यों? कि there is a stamp of authority. जैसे डॉक्टर वसीम ने कहा, डॉक्टर इदरीस साहब ने भी कहा कि ये जो WHO है, Public Health Authority है, those institutions are there, the authorities. When they recommend these things, that is enough for us. We are not, accountable in the court of Allah subhanahu wa ta'ala. If we believe them and we use these, all these vaccinations. So there is no accountability at all in the court of Allah subhanahu wa ta'ala for public. If they get the right information from the right person, which is authorized, like WHO, Public Health Services, all these things are enough for us. Even that is our responsibility. Scholars, organizations, and lot of organizations. I heard from our Shia scholars, maybe Dr. Idris, he knows. our Muslim country, first Muslim country, Iran, they have introduced the vaccination as well. Yesterday, there was a Persian news on their own local channel. तो ये चीजें हमारी जिम्मेदारी बनती है कि हम इसको मैक्सिमम जो है लोगों तक पहुंचाएं, अपने जितने भी मीडियम है उसको यूज करें, इन राइटिंग और सोशल मीडिया के जरिए। ये पॉजिटिव इंफॉर्मेशन जब तक नहीं जाएगी, नेगेटिव इंफॉर्मेशन खत्म नहीं हो सकती।
And I want to continue on this question of tawakkul. You mentioned the fact that
that is very important.
Because people talk about tawakkul when it comes to the virus, and
unfortunately, we believe in inactive reliance. Inactive reliance. I mean, कि बस तवक्कुल करो और कुछ करने की जरूरत नहीं. You don't need to do anything. भाई पीर साहब ने दम कर दिया, and you are safe now. No, there was no big peer than Holy Prophet sallallahu alaihi wasallam. The people who were sitting in the company of Holy Prophet sallallahu alaihi wasallam, Holy Prophet sallallahu alaihi wasallam didn't educate his companion like that. Holy Prophet sallallahu alaihi wasallam always guide them to the proper remedy, to the proper way of knowledge, way of इलाज. उसकी तरफ हुजूर नबी पाक सल्लल्लाहु अलैहि वसल्लम ने उनको गाइड फरमाया. और फिर देखिए, उसके बाद हुजूर नबी करीम सल्लल्लाहु अलैहि वसल्लम ने उनके लिए भी दुआ भी फरमाते, उनको दम भी करते. हुजूर नबी पाक सल्लल्लाहु अलैहि वसल्लम बीमारों को हाथ फेरते, वो शिफायाब भी हो जाते. ही वाज 100% पर्सन ऑफ मिरेकल्स. सारा कुछ होने के बावजूद भी नबी पाक सल्लल्लाहु अलैहि वसल्लम ने ये नहीं फरमाया कि सिर्फ दुआओं पर और सिर्फ अल्लाह की जात पर तवक्कुल करो. नहीं, तवक्कुल का माना यह है कि वी नीड एक्टिव रिलायंस इन अल्लाह सुब्हानहू व तआला. इसका क्या मतलब है? फर्स्ट टाई योर कैमल एंड देन ट्रस्ट इन अल्लाह सुब्हानहू व तआला. पहले अपना ऊंट बांधो, फिर अल्लाह पर तवक्कुल करो. फर्स्ट यू नीड टू ऑब्जर्व ऑल योर प्रिकॉशंस, ऑल रेमेडीज, then make dua in the court of Allah subhanahu wa ta'ala. Oh Allah, we were able to do these things, we have done already, now we need your blessings. This is the meanings of tawakkul. और तावीज़ का भी यही मतलब है, बुजुर्गों से दुआओं कराने का मतलब भी यही है, वजीफे पढ़ने का मतलब भी यही है. पहले अपना इलाज करें, उसके बाद दुआ करें. और ये रॉन्ग कॉन्सेप्ट है कि पीर साहब के पास या किसी शू मंत्र के पास जाएं, और ये दैट इज नॉट अ कॉन्सेप्ट ऑफ आवर दीन.
I think that's a very important point. I mentioned it at the start, and thank you for coming on to that. Dr. Muhammad Idris, there are side effects to these vaccines. What are the side effects? People need to know the reality of this. What are the side effects? And also, once you've got the vaccine, does that mean you don't follow in Pakistan, the SOPs, in the UK, the type of guidance? Is there any need not to follow them, or what is the procedure? Dr. Muhammad Idris.
Yes. Side effects, हम आज पहले से बात हो चुकी है कि more than half a century से हम जो है वैक्सीनेशन लगवा रहे हैं, और हर वैक्सीनेशन के साइड इफ़ेक्ट्स रहे हैं. उसमें माइनर साइड इफ़ेक्ट्स भी हैं, मॉडरेट भी हैं और सीवियर भी हैं. इवन अगर हम फ्लू वैक्सीनेशन को भी देखते हैं जो हर साल हम लगवाते हैं, उसके भी साइड इफ़ेक्ट्स हैं. कोई ऐसी वैक्सीनेशन नहीं है जिसके साइड इफ़ेक्ट्स ना हो. और जितनी भी साइंटिफिक मेडिसिन्स हैं, डॉक्टर वसीम भी हैं, मैं भी हैं, बहुत सारे डॉक्टर सुन भी रहे होंगे, कोई ऐसी मेडिसिन नहीं है जिसका साइड इफेक्ट्स ना हो. हमें पता होता है ये मेडिसिन मैंने आस्पिरिन लिखी है, इसके साइड इफेक्ट्स ये होंगे. पेशेंट को बता देते हैं और फिर उन्हें अलार्म कर देते हैं, अगर हो तो रिपोर्ट बैक कीजिएगा. वैक्सीन के साइड इफेक्ट्स डेफिनेटली हैं. 2% पीपल कैन गेट इंजेक्शन साइट, यहाँ मेरे लगा था इसलिए मैं हाथ लगा रहा हूँ. तो इंजेक्शन साइट पे थोड़ी सी इन्फ्लेमेशन होगी, पेन होगी इधर, ये हेडेक हो सकती है, मसल एक्स एंड पेन हो सकती हैं, थोड़ा सा फीवरिश फीलिंग हो सकती है. ये अर्ली फ्लू लाइक सिम्टम्स हम इन्हें कहते हैं, ये कॉमन है, ये इस वैक्सीनेशन के भी हैं. जो लोग अभी प्रोपोगंडा कर रहे हैं कि जी आप काम करने के काबिल नहीं रहेंगे, आप कभी भी काम नहीं कर सकेंगे, ये ऐसी बात नहीं है। लोगों को 1 दिन 2 दिन पैरासीटामोल खानी पड़ेगी समटाइम, मेजॉरिटी को नहीं खानी पड़ती। जिसको सिम्टम्स आती हैं उनको तो कहते हैं कि जी ये खा लीजिएगा, बकिया ठीक हो जाएगा इंशाल्लाह। सीवियर साइड इफेक्ट जो होता है वो मेजर कंसर्न होते हैं हमारे। अब हमें 5 लाख लोगों को यूके में वैक्सीनेशन हो चुकी है। अभी तक 2 एनाफाइलैक्टॉइड रिएक्शन रिपोर्ट हुए हैं, सिर्फ 2 लोगों को। और वो कौन थे? वो लोग थे जिनको पहले ही एनाफाइलैक्सिस रिएक्शन हो चुके थे। वो उसकी ट्रीटमेंट जो एड्रेनालिन या एपिनेफ्रिन का इंजेक्शन अपनी पॉकेट में रखते थे कि अगर कहीं रिएक्शन हो तो ये लगा दिया जाए। वो रेस्टोरेंट में भी जाएं तो उनको लगाना पड़ता था और उनको लगाना पड़ा, वो ठीक हो गए। ये 2 रिएक्शन यूके में रिपोर्ट हुए हैं। 6 रिएक्शन जो हैं वो यूएसए में रिपोर्ट हुए हैं। इसी तरह 5 लाख लोगों को वैक्सीनेशन देने के बाद ये रिपोर्ट हुए हैं। अब मुझे आप ये बताएं कि अगर इंग्लैंड में 40,000 कोविड पॉजिटिव टेस्ट आज रिपोर्ट हो रहे हैं, उनमें से 700 से ज्यादा लोग मर जाते हैं, और उधर 5 लाख लोगों को वैक्सीनेशन के बाद बेहतर कर लिया जाता है, क्या वो ठीक है या ये ठीक है कि वैक्सीनेशन ना करवाओ और लोगों को मरने दो? I can't understand this concept of the people. They don't look at how many people we are already lost in this battle. कितने डॉक्टर्स, मेडिकल प्रोफेशनल्स, उलमा इकराम, स्कॉलर्स यूके से इस बीमारी का शिकार हो चुके हैं। मेरी और आपकी कम्युनिटी 3 times at a high risk of dying from this disease than the local population. गवर्नमेंट ने हमें प्रायोरिटाइज किया क्योंकि हम हाई रिस्क पे हैं। लोगों ने कहा कि नहीं ये हराम है इसलिए आपको लगा रहे हैं। यार ये कैसी अंडरस्टैंडिंग है, ये कैसी जहनीत है? मैं तो इसको जब सोचता हूँ, समझता हूँ, मुझे समझ आती है कि यार ये लोग कर क्या रहे हैं इस कौम के साथ। आपकी सेहत पे काम हो रहा है, सेहत पे हम लोग दिन रात लगे हुए हैं। गवर्नमेंट 20 पाउंड पे कर रही है इस इंजेक्शन के लिए और हेल्थ स्टाफ लगा हुआ है। मुझे याद है मैंने जिस दिन वैक्सीनेशन करवानी थी, मैंने 3 घंटे लगाए अपॉइंटमेंट लेने के लिए। एज ए कंसल्टेंट मुझे अपॉइंटमेंट नहीं मिल रही थी, क्यों लगे हुए हैं वहां पे। और हमारी कम्युनिटी उर्दू, पंजाबी, इंग्लिश में रोमर्स फैला रही है। जहां सेंटर बने हुए उनके बाहर खड़े होके मिसबिहेव करने के वीडियो मैंने देखे हैं। तो ये साइड इफेक्ट हमें एक्सेप्ट करने हैं। हमें साइड इफेक्ट एक्सेप्ट करना है या अपनी जिंदगी से हाथ धोना है, ये हमें फैसला करना है। तो इसलिए और जी अगला क्वेश्चन आप अभी तो मेरा ख्याल करना चाह रहे हैं।
जी जी, इसमें भी क्वेश्चन है। आई वांट टू आस्क अपॉन दिस। आई थिंक हाउ डू यू फील? दिस इज अ पर्सनल क्वेश्चन बिकॉज एक जमाना था when we had Ibn Haytham and we had Ibn Sina, we had Ibn Rushd, and we had Islamic sciences and we had the libraries in Baghdad, and we had the libraries in Cairo and Andalusia, and you've been a doctor all your life. You've studied these sciences, both yourself and Dr. Wasim. And I'm going to ask this question to you, Dr. Muhammad Idris, and I'm going to ask a few more to Dr. The question is, you've studied all your life, yet no matter what you've studied, many of these people would prefer to listen to somebody on YouTube or WhatsApp जो उर्दू में बात कर रहा है, उनका नाम भी नहीं जानते, उनका पहचान भी नहीं होती. They don't know where they come from, what they've studied, but they can say a few things with a few slides, and they will take them and their opinion rather than any type of knowledge or any type of institution or regulatory body. Is this not the height of ignorance in many ways?
I agree with this. The first thing is, I would say, as we were talking before we started this program, that how many doctors are coming forward facing the community, facing these people. Last Friday, I went for a Friday prayer. I gave 3 times speech on only vaccine. Alama Saab said, I won't give any speech, you will give, because only 50 were allowed. So I gave 3 times. Every time, obviously, I repeated a couple of things and encouraged the people to engage with the health services. But one of the person, he was so negative, he started debating the same way. He did not have any knowledge, but he does not know what the messenger RNA is, but he was talking like a scholar. And I said, okay, that's fine, we can talk about later. The problem here is, when I talk, I'm responsible. If I say something, I'm answerable to GMC and the community I'm serving. But those guys are not answerable, they are not responsible, and they cannot be charged on this because of under the Freedom or Act of Freedom. They can say anything. But when I speak, I will be very careful, like Dr. Wasim Khan, he was saying during pregnancy, breastfeeding women, this is not recommended because there's no trial. I can't say it. That's safe. I can't say that under 16 is safe because it's not trial yet. So I have to talk on the facts, and I speak the facts. I will never ever say there's no side effect. But I have heard one of the clip today from a very renowned presenter, and he was telling the people what a way of reducing Muslim population.
I think that's a very important point. And I mentioned at the start of this show that we are going to have a frank discussion today, because this is the reality within our communities. And the only way to address it is to talk about the ground reality. Jiska naam bhi nahi jante, jiska kaam bhi nahi jante, somebody might be your barber, but makes a YouTube video, you take them as a scholar in sciences. Tomorrow you might go to them maybe when you have a stomachache, maybe go to your barber. We have to look at this very seriously as a community, and that is to ground it upon specialism. Dr. Wasim Khan, I've got a few questions. One quick question, if I can ask, many people are asking, is even after the vaccine, how long does immunity last? Is the first question. The second question is, if you have already had coronavirus, do you then need a vaccine? And the third question is, I think Dr. Mohammed Idris mentioned this. Look, as BAME communities, as we are in many ways, Black, Asian, minority ethnic communities, those from the Pakistani, Bangladeshi, Indian diaspora in the UK, but also abroad, are disproportionately affected from coronavirus. And should we be taking the vaccine more so to protect ourselves? Because we've already seen the first few doctors in the UK that died with coronavirus were Muslim doctors, and many from the BAME community. So should BAME communities be taking the first step in the vaccines, protect themselves, because they are disproportionately already affected? These are the three questions, if that's okay.
Yes, I think during my little explanation, I will explain one of my sister asked about certain other question as well, which is in my mind as well. I need to explain this thing. I need to go back again the trial. Okay, when the trial was conducted, so people was included, and one of the sister asking, I think one of the brother was asking why immunocompromised patient was not included, because they are vulnerable and they need vaccination. Yes, obviously, because the trial criteria is to include healthy individual. If you include immunocompromised, those who are already unwell for other reason, God forbid, if they develop any side effect, it will be lethal for them. So they want to include people, those who are healthy. And then the side effect profile, which Dr. Idris mentioned about it, during the trial, it's already reported, evidence is there, 99.4% develop only, from all these 44,000 people, they develop a like mild to moderate side effect, which means injection site pain and these type of things. Okay. Now come back to other thing. When the trial is concluded and the vaccine is generated, so now, yes, immunocompromised patient included as in the first category. That's why elderly patient, those who are above 80, they got suppressed immunity due to age factor. and they also already got certain other diseases as well. So because of that, that's why these people are included amongst the first cohort group. And obviously, because we are healthcare provider, why we included first time as well? Because of the recurrent exposure, our vulnerabilities increase, because our viral load, if we are affected, is increasing, depend upon how much you are exposing again and again. This is one of the reason. That's one of the first group was included. Now come to the trial wise, how long this immunity lasts. Those who are included in the trial, their monitoring is still going on, will be continuous for 2 years. Okay, and they're checking how much antibodies in their system after getting this coronavirus vaccine. So at the moment, because all our practice is all evidence based, so at the moment we don't know yet whether it will last for 2 months, 3 months, or a year. We know from experience, all the research is done about the flu vaccine. Just like coronavirus, now we're talking about new strain. Flu virus also produce different strain, because system is already in place, and we all know from the evidence that this immunity lasts only for 1 year, and that's why all the vulnerable people get flu vaccine every year. But we can't say at the moment for COVID-19. Similarly, those who affected from COVID-19, that's about one of the question I was explaining. Those who affected already from COVID-19 disease, we don't know how much immunity they will be carrying. Same situation. How many months of antibodies will be in their system for their safety, for their loved one's safety. That's why government is asking, and according to the recommendation from MHRA, because this and WHO, they need also vaccine as well. Do you understand my point? Because there's no data yet. Yes, in 2 years' time, those who participated in a trial, then their data will be there, that person A, antibodies remain there for 2 months, some are 4 months. So they will calculate the data, and when the evidence comes, we will then identify, yes, whether we need a booster dose every 6 months, whether we need a booster dose every year, or whether we do not need it. We all protected, because then antibodies will remain in the system. From the history, we all know that, say for example, hepatitis B we're talking about, okay, is very common among हमारे पाकिस्तानी में बहुत है. हम उसकी अगर 3 डोज ले लेते हैं, we will be protected for long period of time. हम tetanus का पूरा protocol ले लेते हैं. If we got from birth up to 5 dosage of tetanus है, it can give long term immunity. अगर हम हेपेटाइटिस ए की वैक्सीन जब हम ट्रैवल वैक्सीनेशन के लिए लेते हैं, अगर 2 डोजेज विद इन ईयर ले लें, तो वी विल बी प्रोटेक्टेड फॉर लॉन्ग पीरियड ऑफ टाइम, बिकॉज द डेटा इज देयर एंड इट सेज द एंटीबॉडीज विल रिमेन देयर. लेकिन बाज वैक्सीन, जैसे हम हज के लिए जाते हैं, उम्रे के लिए जाते हैं, मेनिंजोकोकल ACWI, we need to get the booster dose every 3 years, because after the research we know the immunity antibodies which was produced by the vaccine, it will diminish within 3 years of time. So we need a vaccine and to boost our immunity. But for COVID-19 vaccine, developing antibodies due to vaccine, developing antibodies after getting infection, there is no trial, no data yet. So it's too early to say whether we need to avoid vaccine if we already got coronavirus or not. I will recommend highly those who got COVID vaccine illness, they need to get vaccine as well. It's safer for them, safer for their loved ones, safer for the community.
Thank you very much. I'm just going to go to our closing statements now. I'm going to go through the panel. They can close. They've been part of this debate. They've mentioned many things. But if we go one by one, I'll go from Dr. Mohammed Idris. Just your roundup statement on today's discussion and your main message today to the entire Muslim community, whether they're here in the UK or in Pakistan and around the world that are listening. What is your message to those from a scientific, medical perspective?
First of all, I mean, this is very important. That the question Dr. Wasim Khan has already answered. Those patients who had a COVID disease and they are now asymptomatic, 4 weeks after their asymptomatic period, they can get vaccination. Once you got vaccination, that does not mean that you should not follow SOPs. You are vaccinated, you are protected. However, you have a chance to get infection, maybe milder, maybe severe, but you will spread this infection to the rest of the community. Therefore, आपको SOPs को फॉलो करना है, उसके बाद भी जब आपका वैक्सीनेशन का पीरियड 2 इंजेक्शन कंप्लीट हो जाएं। ये थोड़ा सा मैं जरा क्लैरिफिकेशन करना चाह रहा था। My message to all the listeners and the Muslim community and everyone, all human beings, is we are facing a common unseen enemy. We have to work together. One step is to follow SOPs. Look after yourself, your community. Don't listen to the false rumors. Those rumors, they don't have any scientific basis or evidence. If you get a chance, if you receive a letter from National Health Services to get vaccinated, take it as a blessing for yourself. Don't reject it. This is for your life, for life of your family, and for rest of the people. So please, don't listen to the rumors. If you have any doubt, talk to your doctors, talk to your whosoever you trust for your health whole life. I would say that is your doctor. You trust them for all diseases. Why don't you trust them now? Thank you.
Thank you. And Dr. Wasim Karmo, over to you, your final comments for today's show.
Yeah, thank you very much. First of all, Minhaj Quran, to organizing such a nice platform to explain our experience as well. My last question in simple word, just like Dr. Idris says, to save our loved one, okay, to save the community, to save yourself. यहाँ पर मैं थोड़ा सा एक्सप्लेन करूंगा इन सिंपल उर्दू वर्ड कि जब हम वैक्सीन खुद लेते हैं तो हमारी प्रोटेक्शन तो हो जाती है, ठीक है। इट डजंट मीन्स कि हम दोबारा इन्फेक्टेड नहीं हो सकते। वो वायरस जब आता है उस वैक्सीन की वजह से हमारे अंदर एंटीबॉडीज है, वो उस वायरस को फाइट करेगा एंड हमें सेफ कर लेगा। लेकिन हमारे पास वायरस है, हम तो सेफ हो रहे हैं, लेकिन वी कैन इजीली ट्रांसमिट दिस वायरस टू आवर लव्ड वन, आवर एल्डरलीज, एनीवन। उनके लिए वो नुकसानदेह साबित हो सकता है। हमें एंटीबॉडीज मिल गई हैं ड्यू टू वैक्सीन। इट डजंट मीन कि हम एसओपी को इग्नोर करें। अपनी जो बेसिक हाइजीन है, जो इस्लाम भी बताता है, हैंड वॉशिंग से लेके तमाम चीज करें, फेस मास्क, क्योंकि उससे ट्रांसमिशन रेट बचाने के लिए सोशल डिस्टेंसिंग रखें। उसके साइंटिफिक एविडेंस है कि जब हम स्नीज करते हैं या कॉफ करते हैं किस तरह से वो एटमॉस्फेयर में वायरस रहता है। दीज आर ऑल एविडेंस बेस्ड एडवाइस। तो हम वैक्सीन के बाद भी और कोविड-19 इलनेस होने के बावजूद भी अपने एसओपीज और पीपी जो सोशल डिस्टेंसिंग है, हैंड वॉशिंग है, उसका ख्याल रखें। जिस तरह वैक्सीन के बाद हमारी एंटीबॉडीज हमें प्रिवेंट कर रही है, वी डोंट नो कब तक, लेकिन उसी तरह डिजीज के बाद भी हमारी एंटीबॉडीज हमें प्रिवेंट करेगी, ठीक है। लेकिन हम फिर भी इन्फेक्टेड हो सकते हैं उस वायरस से। जो एंटीबॉडीज बनी होगी वो हमें तो सेव कर लेगी, लेकिन हम वो वायरस किसी और को पास कर सकते हैं, अपने लव वन को पास कर सकते हैं, जिसके लिए जरूरी है कि हम ये एसओपी का ख्याल रखें।
Jazakallah. And Allama Shahid Babar Sahab, who is the president of Minhaj Scholars Forum, over to you for your final words.
Thank you very much. First of all, I would like to congratulate Sayyid Ali Abbas Bukhari Saab and his team, who's the executive of Minhaj al-Quran International UK. They organized this beautiful program and try to give the proper information, positive information to our community. I'm really grateful to them. And my final message is for our listeners: get vaccinated, save yourself, and save your community. इसी के अंदर हमारी निजात है। और दूसरी चीज जो है कि अगर आपको कोई डाउट है, अपने जीपी के पास, अपने किसी भी जो ट्रस्टवर्दी पढ़ा लिखा आदमी है उसके साथ राब्ता करें। किसी भी सोशल मीडिया पर बैठे हुए किसी ऐसी चीज को ना सुने जो आपके लिए और हमारी कम्युनिटी के लिए नुकसानदेह का बाइस बने।
I want
बहुत
to
शुक्रिया।
say thank you to our illustrious panel. All of you guys have been extremely helpful. I want to congratulate all of you guys and thank you for joining us today on this online discussion of COVID-19 vaccine. The comments are there. We've answered many questions. There are many questions that haven't been answered, but I'm sure we've gone over the core topics and areas that many people have discussed. I also want to extend my thank you to Minhajul Quran International UK and Sayyid Ali Abbas Bukhari Saab and his entire team who worked to put on this online discussion, which is a timely discussion. And it's also important because the mission of Minhajul Quran is to bring modern sciences and Islamic sciences together, because it's only when we have the complete understanding of these sciences that we can progress, not just and successful in this dunya and the akhirah as well. And that's why it's so important that we take a notice of this. But my final comments as well on this was, please go back, listen to this discussion, listen to it in great detail. And I say to our elder generation, who are, some of these are many of these are older than us, many of them are my age, many of them are younger than me as well. The biggest issue our community faces in many ways, the World Health Organization says misinformation on vaccines is one of the top 10 threats to global health. But I say one of the top threats to the Muslim community and the Ummah is also misinformation and conspiracies. It is not your duty and obligation to deal with every issue in the world. It's not your duty and obligation to go and to fix every issue in the world and follow conspiracy theories. Our duty and our iman is firstly to protect ourselves, protect the people around us, protect those in our environment and our community. And that is by listening to expertise and following them. So thank you for the discussion. Thank you everybody that joined us. Please follow the guidance of experts, and inshallah it will be successful in this world and the next. Listen to the advice and take it on board. Jazakallah. Assalamu alaikum